Hello, everyone. Good afternoon, everybody. I'm Priyanjali from Bladder Wellness team. I'm sure all of you must be keeping good health. Today, we are going to discuss a very important topic: prostate cancer. Prostate cancer occurs in the prostate gland, which is located just below the bladder in males and surrounds the top portion of the tube that drains the urine from the bladder. Prostate cancer is the most common cancer in men after skin cancer. It grows very slowly, and the chance of getting prostate cancer goes up as man gets older. To throw more light on the subject and guide us on what's right in diagnosis and treatment of prostate cancer, today we have with us renowned urologist Dr. Yashwant Kashyap, MBBS, MD, DM Medical Oncology from Tata Memorial, Mumbai, and senior consultant at Narayana Health Hospital, Raipur. Dr. Yashwant Kashyap has rich experience in the field of oncology. Sir is one of the best oncologists in Raipur, Chhattisgarh, and carries out the treatments with utmost precision and efficiency, ensuring that the patient's health is in safe hands. Over to you, sir. First of all, welcome to today's platform. Our first question for you, doctor, would be what is prostate gland and why is it necessary to maintain its health?
Thank you for kind introduction. Prostate gland is a organ which is found in males and which is located between urinary bladder uh, uh, and means urethra. So it secretes many important products which helps in formation of semen and urination also. Yes.
Right. Doctor, why is it important to maintain the health of prostate gland?
Because prostate is as age increases, the lobe of prostate get enlarged, which leads to urinary obstruction, which will lead patient to be having feeling of incomplete urination and
Right.
increased frequency. That's why it is very much important that every person should maintain prostate hygiene. They should not retain the urine for long time, like
Right.
frequent. Don't let the bladder get full for a long time, like that. Otherwise, with increasing age, when there will be hypertrophy of prostate gland, then they will face the uh, intermittency, then increased frequency, incomplete evacuation of urine, like that symptoms.
Doctor, what are the risk factors of this disease?
Like this all thing ultimately leads to age is the one risk factor. Then other thing is male hormone. Like prostate is driven by the male hormone, which is testosterone and dihydrotestosterone. So with th- patient with hyper testosteronemia, they are more risk for developing prostate cancer. So supplementation of this male hormone that can also lead to this condition.
Right. Doctor, is that cancer caused by genetic factor anyhow?
10% of prostate cancer are caused by genetic factor. That's why in our evaluation of our patient, we also take detailed family history and we send BRCA mutation. BRCA is the tumor suppressor gene, which is known for breast ovarian cancer, but it is also a carrier gene and important target in prostate cancer also. So
Right.
definitely
Uh,
10% are genetic.
Right. So we are saying that if a person is already suffering with prostate cancer, his family may have the chance of gaining it. So for all those people, I mean the family members, how can they, protect themselves from having it?
Our
What are
regular
the
clinic
precautionary steps?
A regular clinical follow-up and patient with
Mm-hmm.
persistent symptoms or related to prostate
Right.
hypertrophy, they should consult doctors and follow the
Right.
doctor's advice.
Right. Now, doctor, please let us know how does one know that he is having prostate cancer? How does one know?
Uh, Most important test is clinical examination. Other tests like PSA, prostate specific antigen level test, these are contributory. But most important is clinical examination. Per rectal examination by a doctor will tell whether it is a prostate hypertrophy or more looking like cancer. Based on that, we plan for biopsy and further uh, CT scan, MRI, or PSMA PET CT. These are the further steps which take. And more around 20 to 30% of our patient, they directly present with backache. So most due to uh, due to early involvement of bone, many patient present with us with bone metastasis. So the backache is also a common symptom of prostate cancer.
Right. Back ache, you mean to say pain
Yes,
in the back? Okay,
back.
this is one of the common symptoms we are saying. Any other symptoms, doctor, which one can know while they are sitting at home?
That hematuria, blood in urine, is also
Mm-hmm.
then other common symptoms like nocturia, increased frequency of urine. They are also common symptoms. Then, if patient has liver involvement due to prostate cancer, then this patient can have weakness, then jaundice. If patient has lung involvement, then this patient can have cough, breathlessness. In rare cases, when there is, it is very rare, but less than 1% of prostate cancer patient have brain metastasis also.
Right. So, doctor, we are saying that 10% of the chances are there that it can, move genetically, or
Yes.
maybe you can acquire it genetically.
Mm.
But for the rest, does it happen because we are prolonging it, we are stretching it for a long time, and then it turns out into a cancer?
Yes, yes, it is because what happened that prostate start like cervical cancer, which start from very benign phase. Like similarly, prostate in start it is for years, 2 3 years, then it get enlarged like that. So that's why clear per rectal examination, PR, digital rectal examination for prostate is very important test which guides us. So PSA can be misleading many a time, but combination of per rectal and PSA is very important for assessing this patient.
Right, right. So, doctor, before it moves on to the cancerous stage, how does the initial stage look like? हमें initial stage में कैसा पता चलेगा कि कैसे होता है initial stage?
Means that can be done by per rectal examination, or some patient, many patients are diagnosed incidentally, like in patients more than 80 90 year, most of the time during finding for something that it got in imaging or something, it is picked up. So around 20 to 30% are asymptomatic patients where only imaging is picking the test.
Right. Doctor, we all know that we have something in our head that we do not want to go to the hospitals. Maybe because why we are scared of the treatment or the operation procedure, whatsoever the reason is, we do not want to visit the hospital very often. For just to have a clear vision for our viewers who are watching us right now, what are the treatments available for prostate cancer?
There are lots. Earlier, there were limited, only surgery was the option. But with advances in medical science, now we have modern chemotherapy drugs, targeted drugs, hormone positive drugs, immunotherapy drugs. So many drugs, advanced radiation technique, many robotic surgeries. So things are getting very positive, and prostate cancer patient, even in advanced stage, are living longer and much better with better quality of life. And earlier there was a thing that for advanced prostate cancer, you just remove the source of hormone, which is testis in males. But we have now newer drugs, newer tablets, hormone suppressing agents, which are controlling this disease. So with medical science, prostate, even in advanced stage, prostate cancer patients are living longer and better.
Right. We get to see with technology advancing on a daily basis, medical science is also developing, advancing on an everyday basis. Doctor, is the treatment painful somehow?
No, no, prostate treatment is not painful. Most around 30 to 40% patient present with pain. So they
Mhm.
after treatment their pain get relieved immediately in 12 to 24 hours. So treatment is not painful, and it is most of the time like you have to take subcutaneous injection or a tablet. So it is very patient friendly also, and patient no need to visit hospital frequently. And this patient even in advanced stage, they do very well.
Right. Doctor, we now know that what is prostate cancer, what are the symptoms. We also know about the treatments available for it. But for the people who thinks that they might have it, because we get to see that it's very normal uh, in a certain age group of men. So, are there any prevention procedures for this? Can someone prevent themselves from having
They
prostate?
should be undergoing yearly clinical examination, and based on clinical examination, if doctor doubts, then PSA or other tests should be done. They
Well,
should be doing
well, we always right,
yes,
right.
yeah, they should be doing clinical examination regular, going for screening. We in our country, means screening is very not that much effective, so patient should be following clinical examination frequently.
Right. Well, we always suggest our viewers, the patients who are watching us, कि आप एक yearly body thorough checkup कीजिए. Not, it's just not for prostate, but a regular checkup is very much important because we do not know what is going inside our body, which is the reason why we always suggest all the viewers कि एक रूटीन चेकअप बहुत जरूरी है ईयरली. एंड आई थिंक दिस विल बी द सोल्यूशन फॉर अ लॉट ऑफ प्रॉब्लम्स. आप अगेन internally क्या हो रहा है शरीर, our body is a very complex subject, so we never know what is going inside. It's always safe to have a routine checkup, which is
Yes,
what doctor is, yes,
yeah, but that
doctor is
routine,
suggesting us today.
yes, but that routine test should be under doctor guidance. It is not that
Yes,
you go somewhere, you get CT scan, PET CT done. It is not routine check. It is definitely taking more side effects and waste of money. Ideally, it should be first consulting a expert. Then, after what he's saying, following that order. It should not be that you going to a random lab doing all the blood tests. This is not the routine test. Routine test
exactly.
means to going to doctor, let the doctor examine, because still clinical examination is the best way. After that, proceed for labs and further imaging and investigation.
Right, right. Also, we always say that our experts are always there to help you out. So reach out to the nearest expert if you have any issues with your body. Please, get it cleared on the early stage. It will be much more easier. Doctor, we also know that having a healthy lifestyle somewhere plays a very vital role in our everyday basis. So coming back to the same point again, how can one keep themselves healthy as possible during the treatment?
During treatment, they should follow the advice of expert. They should not be following the in random things and which are not evidence based. What we are saying or preaching is evidence based. We are following the international and national guidelines which are evidence based. We should not be going on the random thing which is coming in TV or somewhere or paper there and following that thing, stopping treatment, going for something which has no evidence or from some minimum support, we are directly following that. Should always follow the expert because they are uh, very much updated. They are practicing evidence based guidelines.
Right. Doctor, with time, we also get to see that stress also has got a lot to play with the things which are changing in our body. So, does stress play a vital role in prostate cancer as well?
Yes, it has role because with stress comes lots of other comorbidity like risk of diabetes, hypertension, and also the treatment. Because if patient is very much stressed, then he will not follow the will not able to follow the guidelines of doctors completely. And many a time in busy practice, it become very difficult for us to give the patient adequate time because due to crowd in country like India, it become very difficult for us to hear everything from patient. So that's why it is important for them to follow the experts or evidence or don't always believe in what is evidence based thing and don't make extra myths.
Right. Right. Doctor, we also know that there are few diseases which once occur, it has the tendency of occurring again. So does the same thing happen with prostate cancer as well? Is there any chances of, of prostate cancer coming back once it,
Yes, yes. Around
once?
30 to 40% patients are advanced stage. Our patients are at risk of getting this disease back. But with newer drugs, more of targeted tablets, and then hormonal tablets, our patients are getting living longer and getting better with good quality of life.
So are there any signs or symptoms which one should keep a watch on?
Yes, like backache is the one sign which can occur. If disease comes back, then what the patient was having earlier symptoms, they might recur.
Right. Doctor, I can see a few questions coming up from the viewers. Abhishek asks, how does age impact the risk and treatment approach for prostate cancer?
With increasing age, prostate cancer becomes more common. It is disease of generally elderly. Generally, 60 to 70% year of patients, they are at highest risk of getting this disease.
Right. The next question comes from Ankit Mehra, who asks, what lifestyle changes can be made to reduce the risk of developing prostate cancer?
Uh, with increasing obesity, risk of prostate cancer become higher. So we should be controlling obesity. That is important. And second thing is that uh, for diabetic hypertensive, if we are giving drug or treatment to diabetic hypertensive patient, then it become difficult for us to maintain cancer treatment also and diabetes and hypertension. So that's why it is important that this healthy lifestyle and normal diet and all these protocols should be followed.
Right. The next question comes from Rahul Vishwakarma, who asks, what should I do if I notice changes in my urinary habits or other symptoms?
Then you should consult Dr. Rahul, because that can be the some kind of infection, then something related with prostate. So that will be after examination or evaluation only we can find the cause.
Right. The next question is from Sunil Singh, who asks, are there any advancements or promising research in the field of prostate treatment?
Yes, there are many, like robotic surgery. Earlier, every patient has to go through major surgery in prostate. Now, with robotic surgery, less minimally invasive therapy surgery, things are getting better. Now, there are many recent advances in radiation technology also. So, latest radiation machines, LINAC, brachytherapy, and some IGRT. There are many techniques which are also very better. Similarly, in systemic therapy, we have now enzalutamide, abiraterone, then apalutamide, then espelucil T, then immunotherapy, then olaparib, then chemotherapy. So we have so many drugs. So medical science is very progressing, and that's why medical oncology is very important for our patients' holistic care.
Right. Doctor, the next question comes from Rohan Poonawala, who asks, is prostate cancer hereditary and should I be concerned if it runs in my family?
10% are hereditary. So if there is a history of prostate cancer in less than 50 year of age or less than 60 year of age, then family should be screened and patient should be also screened for BRCA mutation, because generally it is disease of 60 year afterwards. But if it occurs in less than 60 year, then it is more aggressive and more related with genetic factors.
Doctor, normally also we get to see that from one disease, there is another gateway open towards another disease. So does the same thing happen with prostate cancer as well? Does it ignites any other diseases?
It generally it is prostate cancer in advanced stages systemic disease per se. It can involve bones, it can involve liver, it can involve lung. So per se it is causing that much thing. And during treatment we can have some side effects, but per se in single entity also in advanced stage it is very aggressive. In some patient, generally in patient less than 60 year of age.
Okay, okay. I can see another question coming up from Ajay. Ajay asked, having a close relative with prostate cancer increases risk or not?
Generally, such risk are very low, but still, as 10% cases are genetic. So, if that relative is young, less than 60-year age, or having BRCA mutation positive, then family should be screened.
Right. The next question comes from Rahul, who asks, what is the role of genetics in prostate cancer risk?
10% of prostate cancer, are due to genetic factor, and now very newer drugs are coming for prostate cancer like olaparib, niraparib. There are targeted drugs which are coming for patient with BRCA mutation positive. Knowing that this patient is having BRCA mutation, we can screen the family and also give these patients this particular drugs as per their requirements.
Right. Doctor, we know that water is the source of life. Also, has a lot to do with prostate. So, what is the usual amount of water which one should intake normally? And while they are being treated, what is the water intake they should take as well?
Generally, we like what we follow, 2 to 3 liter of fluid everyone should take. So generally, we in cancer treatment we don't restrict anything for our patients. So what they are following for earlier they can continue. uh, so water is a very essential part. Many drugs are metabolized by kidney, so for excretion, more taking more water is important. So it is very important for them to maintain adequate hydration.
Right. Doctor, rather than going for urination again and again, which normally happens during the night, are there any painful procedure which involves in urinating as well when they are suffering with prostate cancer?
Generally, it is not that much painful. It is more of retention. So pain is not the symptom. That's why our many patient come in advanced stage, because if pain was then they would have contacted us, come to us earlier. But pain is not that severe symptom. Backache is the one symptom which occurred due to disease going in bones.
Right. So we get to clearly see that it affects the bones, also the livers gradually.
Yes.
Uh, uh, Doctor, while let okay, we are getting another question from Himanshu. Let's attend this first. Himanshu asks, what are the available treatment options for prostate cancer? I think doctor has already mentioned it.
Yes.
And how is the choice made? Okay, how can someone make the choice?
Yes, yes. So we start our around 60% are early stage patient. So we discuss in a combined meeting where there are surgical oncologists, radiation, urologists, and medical oncologists. So after discussion we discuss clinical factors, imaging, and other finding. After finalizing everything, we plan the treatment. Either it will be surgery first, or in a hormonal injection plus radiation, or only systemic therapy, metabolic chemotherapy, or targeted tablets, hormonal tablets, or immunotherapy. So it all depends upon different stages. In advanced stage, role of medical oncology becomes more prominent. Radiation and surgery has some more role in early phase of this cancer.
Right. Doctor, we also know that staying fit or having a healthy fit lifestyle also plays a vital role in a lot of things. Also we have heard a lot of experts saying that physical exercise at least half an hour to 45 minutes every day is very much necessary. So do we suggest that to the patients as well who are suffering from prostate cancer?
Yeah. This healthy lifestyle maintaining is very much important factor, and we suggest for our patient that don't during the therapy don't go for any addiction, or maintain healthy lifestyle, exercise. They should not be uh, altering their normal physical activities and plans, because that will lead to their more mental or other alterations, and exercise is always fruitful.
Doctor, any dietary restrictions or any do's for the patients who are suffering or the people who have some tendency of having
Generally,
prostate cancer?
we don't restrict anything. We don't restrict diet or for our patient. Just healthy diets, normal routine, what they are eating. There should not be uh, alcohol, tobacco, like that. Otherwise, there is no strict diet restriction for our patients.
Right. Uh, Doctor, we have also heard of the term superfood, which I think people are following a lot nowadays. Uh, and somehow we get to see that in Indian household, we find those superfood in our day-to-day life masala or vegetables we get to see in our day-to-day usual life. So are those superfood useful for the prostate cancer patients as well?
Uh, though, as I told, that our practice is evidence based, so we have not seen such trials which is showing that these are very useful or this kind of trial is difficult to conduct also. So if
Right.
someone does big trial giving prostate cancers and other one group giving superfood, other group normal food, then we can confidently say. Otherwise, person should follow the normal routine protocol.
Right. So, Doctor, that was a very, very interesting and, of course, a very engaging session with you today. Before we take a leave, any take home note for our viewers who are watching us right now?
Yes. So I will just say that prostate cancer is now with even in advanced stage with advances in medical oncology, we have very better drug. Earlier there was only option of chemotherapy, but we have now many targeted drugs, immunotherapy, then other hormonal agents. So things are expanding. So you get the proper treatment, follow the expert advice of expert, don't get swayed by the here and there things, and follow the advice of expert.
Well, that was Dr. Yashwant Kashyap for us. Thank you so much, Doctor, for your valuable time. It has been quite an informative session for all our viewers, and we look forward to many more such sessions in the coming future. And thank you, viewers, for your excellent participation. For more information and update, stay connected on our FB page, Bladder Wellness. We are also available on YouTube, Twitter, and Instagram. Thank you so much. Have a great day ahead.